Welcome to This Explainer. I'm absolutely thrilled you're here today. Listen, this session is designed exclusively as an elite, high-yield boot camp for college students who are looking to just absolutely ace their OB/GYN medical terminology certification exams. Now, I know you guys already understand the basic building blocks of general medical terminology. You've put in the hours there, right? So today, we're clearing the deck of the basics and zeroing in exclusively on OB/GYN. We're going to focus strictly on the vital anatomy and surgical procedural words that are practically guaranteed to pop up on your test. So here's our game plan for today. 1. Core OB/GYN anatomical roots. 2. High-yield procedural suffixes. 3. Decoding complex surgical procedures. 4. Vital conditions and complications. And finally, number 5, must-know certification abbreviations. We're going to treat this material like a predictable code, building right from those raw anatomical coordinates all the way up to the complex procedures. All right, let's jump right into Section 1, Core OB/GYN Anatomical Roots. This is all about establishing our baseline coordinates. Okay, you really need to memorize these high-yield roots because they are the critical starting blocks for literally everything else we're going to decode today. Think about gravid/O for pregnancy. You're going to see this used to describe a pregnant woman or the number of pregnancies she's had. Then there's episio for vulva, which is absolutely crucial for surgical terms. We also have nato meaning birth and pero meaning to bear, labor, or childbirth. And here's a pro tip. Certification boards love to test your ability to distinguish between nato and pero, so lock those specific definitions in your mind right now. Moving on to Section 2, high-yield procedural suffixes. We are shifting from anatomy to action here. I want you to notice the stark difference between deliberate clinical actions and sudden medical emergencies on this list. Keep a really close eye on suffixes like centesis for the surgical withdrawal of fluid, and contrast that with rrhexis, which means rupture. Certification examiners absolutely love to test the difference between an action and a condition. You'll also see tocia for birth or labor, and tomy for an incision or cutting into something. Honestly, if you just know these 4 suffixes, you can instantly eliminate half the wrong multiple choice answers on your exam. It's a real game changer. Section 3, Decoding Complex Surgical Procedures. It's time to put those building blocks together and do some translating. You know, these massive, intimidating medical words are really just simple combinations of the roots and suffixes we just reviewed. When you look at the architecture of these words, it's really just basic addition. It's like a giant puzzle. Let's look at a few high-yield examples up close. For example, when you see a word like rrhexis on your exam, don't panic. Your brain might freeze for a second at the sheer length of the word, but just break it down. You have hystero, meaning uterus, and rrhexis, meaning rupture. Put them together. Rupture of the uterus. This is a severe obstetric complication, and identifying it quickly on a timed test is absolutely crucial. Similarly, a super common surgical term like mammoplasty is easily decoded. You take mammo for breast and combine it with plasty for surgical repair. So, surgical repair of the breast. It seems straightforward, right? But examiners will try to trick you by offering definitions related to removing the breast or imaging the breast. Just remember, plasty strictly means repair. And here's a really heavy-hitting exam word you need to watch out for: ovariocentesis. This combines the ovary root with our fluid withdrawal suffix centesis, giving us a precise surgical puncture. It's often performed to relieve pressure or extract fluid from cysts. The critical takeaway here is to recognize that centesis implies the use of a needle for fluid extraction. This separates it entirely from a term like oophorectomy, which would be the actual removal of the ovary. All right, Section 4, Vital Conditions and Complications. Let's look at some critical patient states. Consider the term dystocia. This word is built with the prefix dys, meaning painful or difficult, and the suffix tocia for labor. So it specifically signifies a condition of difficult labor that requires medical intervention, something like a cesarean delivery. If a case study on your exam mentions prolonged, obstructed childbirth, dystocia is exactly the terminology you're looking for. You also need to flag eclampsia in your notes right now. This is a severe, high-stakes pregnancy complication characterized by seizures, and it's often related to high blood pressure. But listen, do not confuse this with preeclampsia. Preeclampsia features high blood pressure but hasn't progressed to the seizure stage yet. The actual presence of seizures is the defining, highly testable difference for eclampsia. Next up, you need to be ready to quickly differentiate between menstrual irregularities. Metrorrhagia is bleeding from the uterus at any time other than during the normal menstrual period. Compare that to oligomenorrhea, which refers to light or infrequent menstrual periods, which often indicates hormonal imbalances. The prefixes metro for uterus and oligo for scanty or few, those are your decoder keys right there. Now, from a purely clinical perspective, please note that a threatened abortion refers strictly to bleeding, with a threat of miscarriage that requires close medical monitoring. On your exams, you have to separate everyday colloquial language from strict clinical definitions. In medical terminology, abortion simply refers to the termination of a pregnancy, whether it's spontaneous, like a miscarriage, or induced. So a threatened abortion means a pregnancy is still viable, but the bleeding indicates a high risk. All right, time for a quick active recall check. Imagine you're sitting in the exam room right now. If your test asks for the procedural term describing the surgical repair of a cystocele, which, as we know, is a protrusion of the bladder into the vagina, what is it? Think about the root for vagina and the suffix for surgical repair. Got it? The answer is colporrhaphy. This is a very high probability exam term. It combines the colp/o root for vagina with the raphy suffix, which indicates suturing or surgical repair. Whether it's repairing a cystocele involving the bladder or a rectocele involving the rectum, colporrhaphy is the umbrella procedural term you need to be ready to select. Finally, Section 5, Must Know Certification Abbreviations. Let's look at real-world charting. We're going to rapid fire through these, so treat them exactly like flashcards. You must instantly know EDC stands for Estimated Date of Confinement, which is just the clinical way to say due date. You know HSV is herpes simplex virus, and STD is sexually transmitted disease. But pay special attention to TAB. It stands for a therapeutic abortion, which is a medical procedure performed to terminate a pregnancy specifically for maternal or fetal health reasons. Lock in HRT for hormone replacement therapy, and PID for pelvic inflammatory disease, which is an inflammation of the entire female pelvic cavity. But pay very close attention to LEAP and CIN2. LEAP stands for Loop Electrosurgical Excision Procedure, which is a vital treatment for cervical dysplasia. And CIN2 stands for Cervical Intraepithelial Neoplasia Grade 2. These two frequently show up together in tricky board questions regarding abnormal pap smears, cervical dysplasia, and cancer screening pathways. And just like that, you have the structural decoder ring to translate virtually any OBGYN term they throw at you. By mastering these specific roots, suffixes, and procedural builds, you've taken so much of the guesswork out of your test prep. So the only question left for you is, now that you have the key, how fast can you translate these terms under the pressure of exam day? Keep practicing these concepts, build your speed, and you are absolutely going to crush it. Thanks for learning with me on this explainer, and I will see you next time.